Hello and welcome to the Pace Hospitals podcast. Today, we are diving into a simple, powerful diagnostic tool that plays a key role in detecting various health conditions. That is, Complete Urine Examination, also called as CUE test. While often part of routine health checkups, the CUE test provides valuable insights into kidney function, urinary tract health, and even systemic conditions like diabetes and liver disease. Today, we are joined by Dr. Kishore Kumar, consultant nephrologist and kidney transplant physician, to discuss the CUE test. He will cover what the test is, why and when it is recommended, the key parameter it evaluates, how to interpret results, necessary precautions, common abnormalities detected, and how this simple test offers vital insights into kidney health, urinary tract infections, metabolic disorders, and more. Dr. Kishore Kumar, thank you for joining us at Pace Hospitals, High Tech City. Let's start by understanding what are the precautionary measures to keep in mind before undergoing a complete urine examination.
Any patient who wants to get a complete urine examination has to follow few precautions. The first and the foremost one is at least 24 hours before giving a urine sample for examination, the patient should not do heavy strenuous exercise like lifting weights or running or playing heavy games, because after these strenuous exercises sometimes patients can pass protein or blood in the urine, which can lead to abnormal urine examination result. So avoiding strenuous exercise at least 24 hours before giving urine sample is important. The second precaution is for females. Avoid giving complete urine examination sample while you are menstruating, because there will be contamination of menstrual blood in the urine, which can lead to abnormal result of positive blood in the urine. So avoid giving complete urine examination sample during the period of menstruation. Third one is the time of collection for complete urine examination sample. So it is better to give complete sample for complete urine examination the first morning sample or the second morning sample. These are the usual adequate samples for complete urine examination. Now I will be speaking about the method to collect the urine for complete urine examination.
Dr. Kishore Kumar, could you explain the proper method for collecting urine for a complete urine examination?
So, as I've previously mentioned, first morning or the second morning sample is usually adequate for complete urine examination. So, while collecting the urine for complete urine examination, it is better to give a midstream urine. So, the meaning of midstream urine is we have to pass the urine into the commode. We should not pass the urine directly into the container into which we are collecting the sample. We need to pass the urine in the commode and we need to bring the container from the side and we need to collect the midstream urine, not the first urine or the last urine. So you should not directly collect the urine into the container, but you should bring the container while you are passing the urine so that the middle stream of the urine is to be collected. This is important because while we are passing the urine, the first urine which will come out will have the contamination from the skin, which can lead to abnormal results in the urine examination. And the last urine also can have this contamination. So the midstream or the mid part of the urine stream is important for collecting the urine. Another important precaution which we need to take is after giving the urine sample, the analysis has to be done within 3 to 4 hours, because if you keep the urine at room temperature for beyond 4 hours, the results will be abnormal. The cells which are present in the urine can get lysed and the result will be abnormal. So if there is any delay in analyzing the urine sample should be refrigerated at 4 to 8 degrees. And after that, that sample can be given for analysis. So these are the important precautions and the methods for collecting the urine.
So, doctor, report of complete urine examination. What does it include and how can it provide valuable insight into our health?
So now I will be discussing about the report of complete urine examination and what each parameter will tell us about the patient's condition. The first one is the physical examination, the second one is the chemical characteristics, the third one is the microscopic examination. In the first one, the physical examination. In the physical examination, we usually check the color of the urine and its transparency. The normal color of urine is from pale yellow to dark yellow. Pale yellow urine will be seen if the urine is diluted. If the patient takes more amount of water, if we take more amount of water, the urine will be diluted and the urine will be pale yellow in color. If we take less amount of water, the urine will be more concentrated and urine can be dark yellow. This is seen especially during the summer months, where there will be more loss of water from our body due to excess heat, and urine can be more concentrated and it can be dark yellow in color. The other parameter is the transparency. Normal urine is transparent. If the urine is not transparent and if the urine is cloudy, it can be because of some cells which are present in the urine, like it can be the white blood cells or red blood cells, or sometimes it can be because of the infection which can be present in the urine. So these are the conditions where the color of the urine can change and the transparency of the urine can change. The third parameter which we look at in the physical appearance is the specific gravity. The specific gravity of the urine is normally between 1.005 to 1.030. So if the specific gravity is less, it means that the urine is more diluted. In some patients who are taking excess amounts of water, the urine will become more diluted. So this is about, and if the specific gravity is more than 1.030, it means that the urine is more concentrated, or there are some external agents which are present in the urine, because of which the specific gravity will be high. Especially after doing a contrast CT scan, the urine concentration, the specific gravity will be very high, because that the contrast which we have, the doctors or the radiologists give, will be excreted in the urine, and the specific gravity will become very high. So normal range of specific gravity is somewhere between 1.005 to 1.030. Now coming to the chemical characteristics of the urine examination. The chemical characteristics of the urine examination will be done by something called as reagent strips. These reagent strips are the cardboard sticks which are dipped into the urine, and after some time there will be color change in that cardboard sticks, and which will be compared with the chart which is given on the box of the cardboard sticks to identify whether there are any abnormal chemical characteristics in that urine. The chemical characteristics which we look at while doing complete urine examination are urine pH. We will check for protein loss in the urine, glucose loss in the urine, or if there is any bilirubin in the urine, or if there are any ketones in the urine, or if there is any nitrates or leukocytes. These are the important parameters which we look at.
Could you explain what are the parameters of complete urine examination?
Now I will be discussing about each of these parameters. The first one is the urine pH. Urine pH, normally it is somewhere between 4.5 to 7.5. If the urine pH is towards the lesser end of the value, it means that the urine is more acidic. More amount of acid is being lost in the urine. If the urine pH is more than 7.5, it means that the urine is more alkaline. Alkaline urine means that more amount of base is being lost in the urine. This can give important information, especially in patients who have kidney stones, because in specific urine pH, specific types of kidney stones are formed. So this urine pH is important in these patients, and sometimes in urine infection the urine pH will be high. In bacterial urinary infection, urine pH can be high. So this is about the urine pH. The second one is about the protein loss in the urine. The protein loss which is given by complete urine examination will be mentioned like nil protein or trace protein, or 1 plus or 2 plus or 3 plus. So here these values are the semi-quantitative values. These are not the exact values, because sometimes nil protein or the trace protein, the protein the protein loss in the urine can be present, but that the dipstick or the cardboard stick which we have used is not able to identify that small amount of protein loss in the urine. This is especially important in patients with diabetes, where there will be very small amount of protein loss in the urine, which is important to be identified. So in those patients, albumin creatinine ratio is important to identify this small amount of protein loss, because there will be change in the treatment decisions if this small amount of protein loss is also present, which complete urine examination usually won't identify. If the protein loss in the urine increases, the values of the protein loss will increase, like from 1 plus to 3 plus to 3 plus to 4 plus. As the number of plus increases, the large amount of protein is being lost in the urine. Now coming to the third one, this is the glucose positivity in the urine. Normally, our body, if the sugars increase up to a certain level, the glucose will be absorbed from the kidney and into the blood, back into the blood. But if the glucose levels in the blood are very high, the absorptive capacity of the kidney will be overridden and the glucose is lost into the urine. So as the number of plus increases in the glucose, the more amount of glucose is being lost in the urine. The glucose loss in the urine is usually seen in patients with uncontrolled diabetes, where the blood sugars are high, which can lead to positive glucose value in the urine. Nowadays, there are new medications like dapagliflozin, which are commonly given to all the diabetes patients. These medications act in the kidney by losing the glucose in the urine. So these medications will prevent the absorption of glucose in the urine. So any patient who is taking this dapagliflozin will have positive blood glucose in the urine. Even though their blood glucose values are normal, their urine may show positive glucose result. So this is important to know. Now coming to the fourth parameter, which is the bilirubin. Normally, very small amounts of bilirubin are present in the urine. If the levels increase, especially in patients with liver disease, the high amount of bilirubin will be lost in the urine, which can be seen by change in the color of the urine, or which can be identified by the dipstick. Normally, ketones are absent in the urine. The ketones are positive, especially in patients who are fasting. These ketones are basically the fat breakdown products which are lost in the urine when their levels are high in the blood. So especially in patients who are fasting for a prolonged period of time, the fat will be broken down and ultimately these ketones are formed, and these are positive in the urine. Sometimes in patients with diabetic ketoacidosis, these ketones are also positive in the urine. So this will give the important information in these type of patients. The other two parameters which we usually look are the leukocytes or the nitrites. Normally, leukocytes are the white blood cells which are present in the blood. Sometimes these leukocytes are lost in the urine due to various conditions. So, these leukocytes, if they are present, it can be identified by the reagent dipstick. So, if the leukocytes are present in the urine, it can suggest infection, or it can be suggesting an allergic kidney reaction also. If the nitrites are present, it can be because of bacterial infection. Normally, these nitrites are produced by the bacteria. If the nitrites are present, it can be because of the urinary infection. So, by doing a dipstick examination, if we find leukocytes or if we find nitrites, especially in a patient who is suffering from burning micturition, or if he is having urinary symptoms, it will give us a hint that this patient might be suffering from an urinary infection. So this is about the physical characteristics of the complete urine examination.
Dr. Kishore Kumar, can you explain the importance of microscopy examination in diagnosing the kidney and urinary tract conditions, and what key insights it can provide?
Now coming to the microscopic examination. Complete urine examination is incomplete without doing a microscopy, because the microscopy will give us a lot of information about the complete urine, about the patient and the urine, and it can also give us hint about the underlying kidney related or the systemic conditions. The first one which we will look in complete urine examination in the microscopy is the pus cells or the white blood cells. These are the white blood cells which can be seen in the urine. Normally up to 5 pus cells are normal in any patient, below 5. If the pus cells are more than that, it means that the pus cells are leaking into the urine. The leaking of pus cells in the urine can be because of number of causes. Like if there is an infection in the urine, the pus cells can be high. If there are kidney stones also, pus cells can be high. If there is any kidney related problem related to the structure of the kidney or the glomerulus or the filtering part of the kidney, these white blood cells can be leaking into the urine. So these are the common conditions where the pus cells can be present. But the most important one is the urinary infection. Very high number of pus cells and the patient has symptoms, or if there is any abnormality in the kidney function test, we need to suspect the urinary infection. Now the second one is about the red blood cells. Normally red blood cells are absent in the urine, and up to 3 red blood cells per high power field can be seen in the complete urine examination. But if there are more number of red blood cells in the urine, it can be because the red blood cells are leaking into the urine. The most common cause for the leakage of red blood cells in the urine is the urinary infection, or it can also be because of the kidney stones. And the most important thing which we should not miss is about the kidney related glomerular problems, the kidney structure related or the kidney related diseases. So any patient who has protein loss in the urine, and also along with that, if there are red blood cells in the urine, it means that we should be thinking about some kidney related issue. It can be stones or infection, or it can be kidney structure related problem. So this is about the red blood cells. Now coming to the other cells which we look at in the urine, it is about the epithelial cells. These are commonly present in the urine, and this for the normal complete urine examination won't give much information in an isolated form. More number of epithelial cells in the urine along with in a patient with kidney problem can give some hints about the tubular damage inside the kidney. The other thing which we will look in the microscopy is about the bacteria. Normally bacteria, if there are more number of bacteria seen in the urine, it can be because of the contamination, or it can be because of the infection also. So clean cat sample is important, or the midstream sample is important to prevent that bacterial contamination. If any patient who has given a clean sample with a midstream sample, and if there are more number of bacteria in the urine, it means that there may be urinary infection. The other thing which we will look in the microscopy of the urine is about the crystals. Normally crystals are sometimes found in the urine, but especially in patients who are having kidney stones, the presence of these crystals, the type of crystals, can give the hint about the type of the stones patient can be having. There are different types of kidney stones like calcium oxalate stones, uric acid stones, or cysteine stones. These are the types of stones which are usually seen. So if a specific type of crystal is seen in the urine, it can give us indirectly the hint that this patient can be having that type of stone, so that we can change our management to prevent that stones in that patient. So this is about the crystals.
So doctor, what are the indications of complete urine examination?
The first and the foremost is commonly these days as a part of routine health checkup, complete urine examination is done. If we take the indications from the doctor side, complete urine examination is usually done if there is any doubt of the kidney related problems, like if the patient is having high creatinine value, or if the patient is having any urinary complaints, like if the patient is having less urine output, or if the patient is passing foam in the urine, or if the color of the urine is abnormal, or if the patient is suffering from burning micturition, or if the patient is having excessive frequency of the urination, or if the patient has a swelling of the body, to identify if the patient is losing protein in the urine. So these are the usual common indications for complete urine examination.
Can you explain what are the factors affecting complete urine examination?
Factors which we need to keep in mind are, we should not give sample within 24 hours of heavy exercise or heavy sporting games, and the second one is to avoid giving complete urine examination sample during the time of menstruation. The third one is to do not give a contaminated sample, means that do not give a sample which is not midstream or which is not clean catch, because this can lead to contamination with the bacteria on the skin and it can lead to abnormal results. And the fourth one is to give the sample, first morning sample or the second morning sample, which are usually adequate for the best complete urine examination.
Dr. Kishore Kumar, what are the benefits of complete urine examination?
Complete urine examination will give us a lot of information. The first and the foremost is that if there is any protein loss in the urine, we can identify the kidney problem early. So protein loss in the urine can be because of infection or it can be because of the leak from the kidneys. So if any patient is having protein loss in the urine, we will quantify the amount of protein loss in the urine by doing a 24-hour test. And if there is high protein loss, we will do a kidney biopsy to identify what is going inside the kidney. So the complete urine examination is the first step to identify such problems. The second one is if the patient is having any red blood cells in the urine. The red blood cells can be because of infection, or it can be because of the stones, or it can be because of the kidney related problems. So when we encounter red blood cells in the urine, we will think about these problems in the patient and we will be doing that investigations to identify whether the patient is having infection or kidney stones or the kidney related problems. Sometimes complete urine examination, we do cytology of the complete urine examination. In the cytology part, sometimes the urological malignancies, the bladder malignancies or the kidney malignancies can be identified, because the malignant cells or the cancer cells can be shed in the urine, and those cancer cells are identified during the microscopic examination of the cytology. So this can give us hint that there are some abnormal cells in the urine, and we have to investigate from where they are coming. It can be from the bladder or from the kidney.
Thank you, Dr. Kishore Kumar, for sharing crucial information regarding the complete urine examination to our listeners. If you have any further questions regarding the CUG test, don't hesitate to consult a nephrologist. Remember, this simple test can provide valuable insights into your kidney health, urinary tract infections, and metabolic disorders. Early detection and timely intervention can make a significant difference in managing and protecting your overall well-being. We will see you soon with another episode on Pace Hospital podcast. Until next time, stay informed, stay proactive, and take good care of your health. Thank you.